Good morning. I am happy to hop back on here. It's been a while, but life has just been crazy. So just the fact that my face is behind this camera means that things have calmed down enough for me to share a little bit more. So I just wanted to give obviously an update on Ruby and just a little life update. But in order to do so, I just want to bring everybody up to speed. So I came on here in April from the hospital when Ruby was dealing with what we thought at the time was a really wicked stomach bug, coupled with an anemia that the doctors felt like was making it harder for her to fight off the bug. And so I came to you while they were giving her a blood transfusion that they had hoped would help her be strong enough to fight off the virus. And it worked, or so we thought. So we got the blood transfusion on Saturday, and we ended up being discharged from the hospital on Sunday. We were home for a few short hours before Ruby began vomiting again. And she was also showing a lot of discomfort when you would lay her on her back. And so obviously the vomit alone would have been enough to send us back to the ER, but we were just really uneasy about, I don't know, it seemed very odd. She would be okay if you sit her up, but to lay her down, she would begin crying hysterically. And so we knew something was wrong. And so we went back to the ER. James drove me so I could sit with Ruby in the back, even though he could not come in because all of this is happening during the COVID situation. And I'm grateful for the ER doctor for having what I would say is a healthy respect for the medical complexity that Ruby is. And I say that because we're never going to be able to assume that Ruby's symptoms can be explained by a normal child's explanation. Ruby's medical complexities at this point are very great. And so I feel like this doctor had, as I said, like a healthy respect for Ruby. And I'm grateful for that because the doctor ordered a head CT and it saved Ruby's life. So the head CT showed that Ruby had developed an intracranial hemorrhage. And so what we know now is that due to complications from the Lovenox injections that we pretty much have given Ruby every day of her life, except for like 1 month from December to January. They're blood thinners. And so the blood thinners caused Ruby to develop a brain bleed. And it had been bleeding for what the neurosurgeon said must have been some time. So we don't know, probably a couple of weeks. And the brain bleed was the cause of what we thought was anemia. It was also the cause of the vomiting symptoms. So we were transferred in the middle of the night downtown to the medical center and met by neurosurgery. While we were still in the Woodlands, obviously they prepared Ruby for transport. They gave her a dose. I should know it better, but I want to say it's like hypertonic something that's supposed to help with the swelling. So the bleeding in Ruby's brain was so significant that it was causing swelling, and it was causing what they call a midline shift. And so if you've ever looked at an MRI of the brain or a head CT, then obviously you can see a middle and a right and a left. That was backwards. This was right. And then there's a butterfly shape in the middle as well of space. And so a midline shift is when literally there was so much blood that it was causing so much pressure on her brain that the midline was shifted over and that butterfly shape was compressed. And so I was not in the best headspace in the Woodlands. I was in and out of being hysterical because I was truly in shock. I mentioned on the last video that when we got to the ER with vomiting symptoms, the previous week, it was really heavy to know that one of the first things they came down and did was to do an echocardiogram to rule out heart failure. So, there's an ambulance going by. So that's always heavy, like in the back of your mind to know, like, stomach bug, heart failure, two opposite ends of the spectrum, and just the heaviness of where we live. So to go from ruling out heart failure, confirming stomach bug, and then going from stomach bug to brain bleed, it was not something I was prepared for. And I was scared, very scared. I am thankful for the patient doctors and nurses who not only dealt with me, but also comforted me. I can remember crying when the doctor was telling me and apologizing to her, and she said, please don't apologize. And I can remember the nurses who literally helped pick me up off the floor, because it was one thing to hear the news, but to have to pick up the phone and call James and share the news. I just couldn't believe the words as they were coming out of my mouth. So James came back up to the hospital because I was not able to ride with Ruby on the ambulance because of COVID. And so he came back up to the hospital to drive me downtown. And we got downtown and he got to see Ruby again before they wheeled her upstairs. And so we came up to the PICU and were greeted by neurosurgery. And I recognized the woman immediately because she had rounded on Ruby in January. And she brought me over to the computer and she pulled up Ruby's brain scan, a CT scan, and showed me the blood and the amount of blood and pointed out the midline shift and all of these things. And when we were transferred downtown, we knew neurosurgery was consulting, but we did not know that brain surgery was a guarantee. And so within minutes of getting into the room, I may have still had my purse on my shoulder. She told me that they were going to be taking Ruby into surgery to remove the clot, to evacuate the clot. And I fell to my knees. I was terrified. I haven't often talked about sheer fear here, but I was terrified. I know the brain is complex. I know in anybody there are risks, but I was especially worried about Ruby. I was worried about this brain bleed causing further deficits, causing further damage. I was worried, obviously, about just going under anesthesia again. I was worried how her heart would handle a surgery. I was worried about everything, and I was hysterical. And I am so, so grateful. At the time, I don't think I felt grateful, but I am so grateful for surgeons who have the ability to remove emotion from a situation in order to do their job effectively. And that's what this woman did this day when she was giving me this news. She was a neurosurgery fellow, and she allowed me to compose myself and stand back up. And when she knew that I was ready to continue hearing, she began again explaining what they were going to do. So we kind of settled in, and that's at that point I called James. I mean, he was still not far away, and let him know, like, they were doing surgery, like, this morning, as soon as they could get her cleared for surgery. So what had to happen was that they had to give her a dose of a medication to counteract the Lovenox. So we had given her a therapeutic dose of a blood thinner, and we had to just like I said, counteract that. And so they gave her that dose of medicine, and about an hour later took her blood levels again. And so hematology had to sign off on the levels in order to approve Ruby for surgery. And so obviously it was like a constant in and out. It was a mad dash of different people from the neurosurgery department, obviously the PICU teams, and then the anesthesiologists and their teams. And so I was holding Ruby most of the morning, crying hysterically over her, praying over her, listening to our praise music, and sobbing with just tears rolling down my face all morning long. When I handed Ruby off for heart surgery, I didn't have the same fears that I had on this day. I was blissfully ignorant as to how severe complications can be. And so, fast forward to April, when I have witnessed the worst of the worst when it comes to complications, and I was really feeling it. So, as I have done so many times, I reached out for prayer to many of you, and was flooded with prayers. And I went from this state, and I'm going to share a picture on here in just a minute, and it is one of the most raw pictures I will likely ever share. It does me no favors, but I hope that it conveys the type of pain I was feeling. But after I reached out for prayers and you all delivered like you have so many times, I was instantly flooded with peace and comfort. It was like a 180 of how my mood felt. To the point to where when I walked with the surgical team and they left me at the elevators and wheeled my baby away, I did not cry another tear even right then, because at this point I was grateful. I was grateful for a diagnosis, and I was grateful for a solution and a surgery. And I shifted from being fearful to being confident in the medical team's ability to take care of my daughter. And they did.
You are not hidden. There's never been a moment you were forgotten. You are not hopeless. Though you have been broken, your innocence stolen, I hear you whisper underneath your breath. I hear your SOS, your SOS.
So like I said, they did. The doctors performed a successful surgery on Ruby. They were able to successfully remove the bleeding, the hemorrhage. So it was an intracranial hemorrhage, also called a subdural hematoma. And the doctor was very pleased with how the surgery went and how Ruby handled it, everything. Her vitals were strong throughout the surgery, all the things you want to hear as a mama. And so, just crazy. We have been into many procedures, and we've always been told that they hope to extubate in the OR, and it has yet to happen. But they extubated Ruby in the OR, so she came back to the room not even with a breathing tube, which is so much easier on this mama heart. If you have never seen your child intubated, good for you. I hope you never have to. It's one of those really, really difficult things. And so ultimately, as her medication began wearing off, she woke up that afternoon and I was even able to feed her. She was groggy. And so she was still sleeping a lot, but she was like waking up to eat. And that was just wild to me. It was such a different experience than obviously the one that we had had previously. The next morning, like the PICU team was like, she's like rocking and rolling. Like, we're gonna probably, transfer you guys out today as soon as there's a room ready in the neurosurgery recovery floor in a different building. And I mean, she was like sitting up. PT and OT came to work with her, and it was just, she's a rock star. But on Tuesday, so this happened on Monday, on Tuesday, one of the neurosurgery nurse practitioners came in, and I had seen her in the room, obviously the day previously, but was in no place to have any sort of a conversation. And so I said to her, I was like, I remember you. And she was like, I remember you too. She said, I didn't know if you recognized me. And I was like, well, I did instantly. There was just so much going on because she had rounded on Ruby in January. And so she said when Ruby's name came across, like their case or whatever, that she recognized her name immediately, and that she told her colleagues, you guys, you don't understand. Her mom already said, like, she's in the 1%. And so going back to this conversation that I had with her in January, Ruby's brain was swelling. And at the time, Ruby still had a soft spot, a very pronounced soft spot, fontanelle. And so when neurosurgery would come in, that's what they would feel was her soft spot. And to see if it were bulging, then that was a sign that her brain was swelling too much. And so she told me, and my mom was in the room with me in January, that it's very uncommon in babies that you have to surgically intervene when the brain is swelling. Because of the soft spot, it gives the brain room to swell. And she said, so it's not likely, like we don't, it's not often, it's very rare that we have to surgically intervene. And I told her, like, I didn't mean to sound like, combative, and that wasn't how I said it, but I told her, like, that I don't find much comfort in that. We live in the small percentages that, she's telling me that it's not often, but what she's not saying is that it never happens. And so, so it was basically telling me it could happen because this is Ruby we're talking about. So I told her that, and that is probably the first time that I said and really felt like that didn't provide me the comfort that I think they intended it to provide, because we've already been in those 1%. I have said it many more times since then, but anyways, the fact that it stuck with her and she remembered that, and then like this episode, this bleeding, this event in April, like it was another one of those 1%, which is just crazy, that Ruby keeps living there. But this is going to give me goosebumps as I say it. She mentioned to me that, Ruby's soft spot had saved her life in January, that her soft spot is much smaller now. It's beginning to close. And, but the damaged portions of Ruby's brain don't grow the same way that her healthy brain does. And because they don't grow the same way, it allowed more room for the blood. So quite literally, the stroked portions of Ruby's brain saved her life, because when you're dealing with things like intracranial pressure and midline shifts, the issue or the fear is that the concern is the word I was looking for, is that when the brain runs out of room to swell, that it would herniate down. And that's terminal. And so in January, her soft spot saved her life. And in April, her stroke saved her life. And so that's just, I can live with that. And it just like further proves like we don't have to know all of the why. Like we don't have to know all of the reasons why God chooses to do things, because he knows. And if we just give it to him and follow with him, like we just have to know he's got our back. So ultimately, we ended up being discharged from the hospital on Thursday, which is just crazy. Brain surgery on Monday and discharge on Thursday. We did make one trip back to the ER on Friday because Ruby had quit eating again. And we were scared, and we called, and they were like, let's just get another head CT. And it came back showing, some improvement. It was not like completely clear. And so that's something that, which I'll talk a little bit more about, but we have always, I'm going to say this again, made no apologies for needing that peace of mind, for needing to make a trip to the ER just so we could feel comfortable. I would rather go spend a few hours in the ER and be sent away being told everything's fine than wait and end up in the ER like in dramatic fashion, because we have done it both ways. So the CT scan the day after came back clear, and we kind of settled into what recovery from this would look like.
I will send out an army to find you in the middle of the darkest night. It's true, I will rescue you. There is no distance that cannot be covered over and over. You're not defenseless. I'll be your shelter, I'll be your armor. I hear you whisper underneath your breath. I hear your SOS, your SOS.
The bleeding in Ruby's brain had increased her seizure potential again. And so we had previously been planning to do a repeat EEG in May and then begin weaning her off of anti-seizure medication. But the most recent injury to her brain kind of extended that timeline basically out another 3 months. And so we came home, and we had our first post-op appointment about 2 weeks later. And the doctor shared that he was still somewhat concerned with the level of fluid on Ruby's brain and with the space between her skull and her brain, because her brain doesn't grow. And that alone makes her a risk for future bleeding, even not being on the Lovenox. And so he wanted to just follow her really closely, and we had to follow her symptoms very closely and look for any deviations from normalcy for her that would indicate that the bleeding was back and that she was experiencing some pressure, which was not what we wanted to hear. Obviously, you just want to get like a check mark and a clean bill of health instead of like this kind of continued wait and see. Also, in the midst of this, we went through finally like a comprehensive blood clotting disorder testing that we were never able to do with Ruby because she had always been on blood thinners. And so thankfully, all of that came back negative. So basically it ruled out that Ruby has like an underlying condition that causes her blood to clot. What has caused her clots is the fact that she is a heart baby and her heart doesn't pump the way that yours or mine do. And then also she has had them associated with lines. So when they put these central lines in, basically the lines take up more than half of the vessel that they're in, coupled with the fact that her blood doesn't flow like yours or mine does, makes her, propensity to develop clots greater. And so we were basically cleared from hematology for like ongoing follow-up. The only reason we need to continue to consult hematology is when Ruby needs, some sort of procedure. So that was really great news because neurosurgery did not want her on any form of blood thinners. And so if she had some sort of underlying clotting factor, then hematology would have recommended blood thinners. So we also had a cardiologist appointment and also a cardiac CT. And so at Ruby's last cardiology appointment, her heart function looked great. Her echo looked really good. There were really no issues or concerns, but one potential complication in tetralogy of flow babies is narrowing of the branch pulmonary arteries. And so the doctors wanted to get a baseline CT to look at the size of her arteries. That way they could have it to compare to in the future to know if there was any narrowing. So that was originally scheduled for April, but it got canceled due to COVID. And looking back, I'm so grateful that it did because it might not have shown anything in April. But when we went back at the end of May, I really wasn't expecting any sort of news at cardiology. I was really just expecting, everything looks okay. We're going to continue to monitor her just because she's Ruby and that's what we need to do. But Ruby's cardiologist came in and he visited with us for a bit and, talked about, what he knows from, neurosurgery and hematology and her PT and OT. And, he follows Ruby and all of, the specialists that she sees. But he had a paper in front of him and he took his hands and he put them on his paper and he goes, okay. And then it's like I just knew what we were about to hear. And so he shared with us that Ruby has some narrowing in her branch pulmonary arteries. So the official diagnosis is called LPA stenosis, so left pulmonary artery stenosis, which just, as I said before, means narrowing. And that the complication with the narrowing is that it forces the right ventricle to work too hard. It puts too much pressure on the right side of Ruby's heart. And because of that, it needs to be corrected. So we left cardiology waiting to hear back from the cath lab team the next week for scheduling because Ruby needed to go into the cath lab. And it wasn't something that anybody was incredibly excited about because she still is not cleared from neurosurgery. She has a propensity to form clots, and so we were going to take her into a procedure and put a line in her, and she's going to get a clot, and we weren't going to be able to treat it without risking her brain, and it was all really, really scary. And James and I had just like this numbing effect. Like sometimes, we deal with things when they come at us, like with emotion and raw emotion, and then sometimes like we deal with it by just like going numb. And this was one of those times because you just couldn't believe it. We couldn't believe that we were like dealing with something again. Thankfully, her cardiologist called back the next week, and after meeting with the cardiac interventionalist, that I think that's the right term for it, the doctor who had done Ruby's previous cath, they were able to like further analyze the images from the CT scan. And while there is some narrowing, it wasn't as great as they initially thought. And so she is going to require the procedure, but it wasn't immediate. And so, so that is on the horizon for us. We don't know when. Ruby will tell us when, in her precious little heart. They said maybe 6 to 12 months. So I'm gonna follow her really closely again. And then we also began noticing seizure activity in Ruby at home and in therapy. The first seizure that I witnessed was, they're non-convulsive, so they're not scary like you see in the movies or on TV. So Ruby has limited movement in her left arm due to her stroke, and she used her left arm and was just like going in a circle with it on a blanket, just like rubbing a blanket in a circle like this for like 15 to 20 seconds. Most definitely a seizure. She doesn't move that arm. And so that is it's the rhythmic movement, but also movement of a limb that doesn't typically move. But then we also began noticing these absent seizures. So kind of like these days off spells where she will kind of daze off and be just like looking at nothing, and you can't alert her, you can't stimulate her back. And so Ruby's neurologist increased her anti-seizure medication a little bit, but then also as the seizures began continuing, decided to order an EEG that we just completed last weekend in the house. So we still don't have the results back from that. So we're praying that God has that in his hands. But we went back to neurosurgery last week and had a repeat MRI, and it was far improved over Ruby's first post-op CT. The amount of fluid on her brain is lesser, the amount of blood product is lesser, and he was very pleased with it. So originally he was going to want to see Ruby very regularly. But after the MRI looking so good, he decided that he was comfortable just seeing us like on an as-needed basis. And so we were especially grateful because he had not yet ruled out if he was going to need to do a surgery to put in a permanent drain. And so in our brains and on our chest, like we just had all of this weight of possible brain surgery, definite heart procedure, like when is all of this happening? How is Ruby gonna handle it? And I had actually, I don't even know what set me off the Tuesday before this appointment, but I had left physical therapy and occupational therapy, and I was crying so hard. Something had happened, and I literally don't even remember what, but that's how overwhelmed I have been at times that I can't even remember what set me off, and it might not have been anything significant. But if you know about stress or anxiety, I mean, once you're holding it all in, the smallest things can end up setting you off. And so I can remember crying out to God on Tuesday, saying, God, I cannot handle all of this. I cannot do this all. I need you to take something. I need you to take it all, but I need you to lift something off my plate right now because I cannot do this alone. That was Tuesday. And on Thursday, he eliminated one of those bricks off of my chest. And I am so grateful. I'm so grateful that he cares so intimately about us, that he knows when our faith needs him more, and that he loves us even when our faith is shaking. So that's kind of where we are. We're not living in as much limbo right now. We're kind of hitting a stride of PT and OT, and we will have another cardiologist appointment next month. And then they did neurosurgery, cleared Ruby to begin taking aspirin again, which she needs for her heart. And so because of that, we are going to do in 1 month one more repeat MRI, an appointment just to make sure that the aspirin isn't causing any more bleeding in the brain. And so please just continue to pray with us, and thank you for loving on our sweet baby. And I am hoping to not get on here and have any more of these really dramatic updates. I do want to get on, and I want to do a whole video dedicated to Wyatt and what his life has looked like in the last year, and how he's adjusted to being not just a big brother, but a special needs big brother. And he's the best. So I love you guys, and I'll see you soon.
Will send out an army to find you in the middle of the darkest night. It's true. I will rescue you. I will never stop marching to reach you in the middle of the hardest fight. It's true. I will rescue you.
What is so funny?
I hear the whisper underneath your
Mama.
I hear you